Alright guys, so I'm going to do another little video here talking about another device that can provide PEP or positive expiratory pressure, but this particular device is oscillatory PEP. So we're creating back pressure, can kind of force air underneath secretions, add on a degree of lung expansion theoretically. But the main focus of this is bronchial hygiene. The oscillations as we exhale through a device creates little fluctuations in our flow rate, which is going to enhance secretion mobilization, hopefully move that stuff up to our central airways where we can cough it out a little bit better. So this would be for patients who are expectorating a copious amount of secretion, so at least a shot glass a day, and we have evidence to believe that there's more stuff down there. So we are trying to facilitate and enhance secretion mobilization and helping them clear more stuff up and out of their lungs here. So I'm going to mainly focus on the Aerobica. There's another device, Acapella, same premise, a little bit different functionality. A lot of our sites are using this particular device called the Aerobica. It's made by the same company that makes the breath-actuated nebs, the AeroClips 2s. All right, so this particular little device mainly works on exhalation, okay? Inspiration, we can breathe through it, but it's not doing anything, at least the way I got it set up here right now. So this particular device, as we kind of take a nice breath in, not maximal inhalation, but a good breath in, seal our lips, and make an active exhalation out, we're going to do two things. Once again, we're going to create a little bit of PEP, so it's going to force air underneath our secretions, maybe get some air into some poorly ventilated alveolus, pores of cone, canals of Lambert, all that stuff we learned about. All right, but whenever I'm exhaling, not only am I creating that PEP, but I'm getting little fluctuations in my flow rate. So I do my assessment and everything, kind of show the patient, okay, we got a little mouthpiece here, it's single patient use. You're going to go ahead, kind of sit up nice and tall. Nice breath in, seal your lips, active exhalation. And just like with some of the other PEP devices, not only do I want to see the good vibrations with this particular one, but I want a good long expiratory time or a good long I to E ratio. All right, we have the ability to change the amount of expiratory resistance on this, and ultimately there's a little plus arrow and a minus arrow. If we go all the way over to the minus, it's going to be a little bit less expiratory resistance. I'm not going to create as much PEP. A little easier for me to blow through. You can see my expiratory phase wasn't as long. Likewise, I can go all the way over to the plus side. It's going to be a little bit more expiratory pressure, a little bit more expiratory resistance, and a longer expiratory phase. So with this, we're trying to encourage, I still try and get a patient to do 10 to 20 breaths followed by a big huff cough, okay, and let them kind of recoup. And if we could do 3 to 5 sets of that, that's great. If they can breathe on that for longer, 5, 10, 15, 20 minutes or something, and be coughing and keep doing this as much as they need to clear out of their secretions, right? The good thing about this compared to like an easy PAP or some of the things that require flow meters, we can leave this with a patient. They can use this as much as they like, okay? So if they feel like they got some stuff and they're trying to clear things out of their chest, they can use this around the clock, and we're just coming to evaluate them, several times a day to kind of encourage it, make sure their technique's good, and just kind of assess and see how things are going with this. So I show people how to change this level of resistance, okay? There's no right or wrong. Once again, we want to try and ideally get a good long expiratory phase. So if somebody was just on this easy setting, that's probably not a sustained enough long expiratory phase to make it really, really beneficial. Likewise, if I just had everybody going on plus, that might tire them out. They may not be able to sustain exhalation through that. So I try and tell people to kind of play with what works, but whenever I'm in there and seeing them, I'm trying to kind of push it as far as I can with it out, without it overexerting them, and with it still getting a good long expiratory phase at the same time. Okay, once again, 10 to 20 breaths is ideal for our competency. Clinical practice, try and do 3 to 5 sets, but if they want to do it more, or if you have more time, you can continue doing this, all right? Especially if you feel like you're really making a difference with this. So a cool thing about this device is you can send it home with the patient. So if you look at these little clasps here, you can go ahead and you can take that apart. All right. You can put this in the top rack of your dishwasher, and you could let this thing kind of air dry, and then it's ready to go if you get sick again. Okay, so it's something that you could send home. They could repurpose it after being cleaned, use it for another setback or illness or something like that, unlike some of the early versions like Aerobica and Flutter Valve. Not Aerobica, Acapella and the Flutter Valve, where it was more difficult to clean the inner parts of all that stuff. All right, so let me show you another cool thing. So if your facility is using the breath-actuated nebulizers, okay, so the AeroClips, if you have a patient that can tolerate, all right, a mouthpiece treatment and breathing on this thing for maybe about 5 minutes, if you, let's say you got somebody ordered on a bronchodilator or even like a hypertonic saline or something like that, we could actually do two birds with one stone, okay? So I'm going to go ahead, I'm going to squirt a little normal saline in my nebulizer here and kind of show you what I mean. Now, not everybody's going to be able to tolerate this, all right? So I'm going to squirt a little normal saline in here. So let's say my patient's doing pretty well, not looking like it's going to tire them out or anything to breathe on this Aerobica for 5 solid minutes or anything. I can actually take the mouthpiece off of my band. I can hook this up right like this. All right. So I'm going to go ahead. I still run this about 8 liters a minute. So I'm going to go ahead. I'd have my assessment done. So I'll generally, for most of the patients, I'll run this on the continuous aerosol output side of things. But I will point out, if they can tolerate it, I mean, they got to work a little bit harder to draw that breath in. I can leave it on breath actuate. So whenever I inspire, I'm getting my medication. When I exhale, I'm getting the oscillatory PEP. And actually, that oscillatory PEP is going to help with particle deposition. And that longer expiratory phase stuff staying there and there for longer could actually get a little bit more effective of a treatment. If it seems like it's tiring your patient out or they're really struggling and you're not seeing that ball drop down, it's something like, or they're really having a difficult time, this may not be for them, but at a minimum, you can try and do the continuous little flow there. Now, keep in mind, if they go to pause and take a break and cough, you want to make sure that they're, you're not losing out on their medication or anything like that. So at the end of therapy, or let's say all of a sudden they start coughing, you could go ahead and pause this, encourage the cough, but at a minimum, at the end of that 5 minutes after this nebulizer, you're encouraging that deep breath and cough. But if you wanted to stop it more frequently, totally fine as well. The big thing to remember about this, if you're given a nebulizer with it, especially like a hypertonic saline where it gets all salty and stuff like that, making sure you try and break this thing down afterwards, kind of get out any of the different little condensate and things like that, or little particles deposited on the inside of this. You just want to make sure it's not sitting there kind of soiled and things like that as best of your ability. Okay, so at least popping it open and checking and seeing what you can do. If you can leave it air dry for a little bit, even better, but really requires that patient kind of feeling comfortable putting it back together, which is pretty easy. It's hard to put together wrong. But just my little 2 cents on that particular device, okay? So that shows you how to do the Aerobica. I have another video showing you the instruct for this particular device. This is just me kind of talking through it from the technical side of things, showing you how to manipulate things, talking about how to hook that up, kind of do a tandem with the nebulizer, all right? Some of the other different bronchial hygiene devices, so the Acapella and EasyPAP, I can rig those up on a T-piece as well. It's a little bit more cumbersome, so I can run it on like a Misty Max T-piece neb, regular jet nebs that we've learned about. But I'm not going to do a video for that one here right now, but we can talk about that in lab if you have any questions or want to see it. So I hope that helps, and we'll do this in our lab.